Do you know if you are COVID-free? Get tested and find out. You can help to stop the spread of the coronavirus. Testing is free, and there are plenty of testing appointments available at our convenient COVID-19 testing locations around the island. Book online at www.gov.pm/coronavirus-get-tested or call the COVID-19 hotline at 444-2498. Everyone in Bermuda can help us stay COVID safe.
Good evening, Bermuda, and thank you for joining us. Tonight, I am joined by the Minister of Health, the Honorable Kim Wilson, who will provide an update on the vaccination program, including numbers and statistics of vaccinations and other information from the Ministry of Health. Following that, I will provide you with an update on the next delivery of vaccines and provide an update on a few other matters before I take questions from members of the media. I'm also pleased to share that we are joined tonight by the Chief Medical Officer, Dr. Ayo Oyenloye, who will be able to answer technical and medical questions from the media. So when you pepper us with questions that a doctor should be answering, a doctor will be able to answer them this evening. First, we will begin with the Minister of Health. Minister?
Good afternoon, everyone. The Ministry of Health received 250 test results since the last update. There were 2 recoveries. There are currently 9 active cases in Bermuda, of which 6 are under public health monitoring and 3 are in hospital, none in critical care. Since March 2020, Bermuda has recorded 694 total confirmed cases of COVID-19. Out of those, 673 persons have recovered and 12 persons have sadly succumbed to COVID-19. The mean age of all confirmed positive cases is 43 years, with the median age of 40, and the age ranges from less than 1 year to greater than 100 years. The mean age of all currently active cases is 52 years, with the median being 41 years, and the age range from less than 30 years, and that age group represents 20 to 29 years, to greater than 70 years, and that age group is 70 to 79 years. To protect privacy and confidentiality, age information will not be provided on the hospitalized cases. The mean age of all deceased cases is 75 years, with the median age 77, and the ages range from less than 60, and those age group is from 50 to 59, to greater than 80 years, and that age group is from 80 to 100 years. The source of all cases is as follows: 201 are imported, 491 are classified as local transmission, of which 401 are local transmission with a known contact or source, and 90 are local transmission with an unknown contact or source, and 2 are under investigation. Of the over 160,000 test results reported, the mean age of all persons tested is 43 years, and the median age is 42 years, and the age ranges from less than 1 year to greater than 100 years. Additionally, during the week of the 31st of January to the 6th of February, the 6th of February 2021, results have been received from 4,870 saliva screenings. The mean age of all persons screened is 59 years, with the median also being 59 years, and the age range from less than 10 years to greater than 100 years. The 7-day average of our real-time reproduction number is less than 1, and Bermuda's current country status remains at sporadic cases. While I'm encouraged by the reduction in positive COVID-19 cases, I strongly advise everyone to continue to be vigilant and to follow the guidelines. People may have the perception that there is no coronavirus in Bermuda, and this, we all know, is not the case. We do have 2 cases that are currently under investigation where we cannot identify the source. I would now like to provide an update on the COVID-19 vaccination program. We have completed the 4th full week of vaccinations and the 2nd full week of vaccinations using 2 vaccination centers. For the period through to the 6th of February 2021, Bermuda has administered a total of 9,095 vaccinations, and the breakdown is as follows. A total of 3,999, or 44% males, and 5,105, or 56% females, with 2,048, or 22%, being persons under the age of 50, 2,257, or 25%, being persons between the age of 50 and 64, 3,284, or 36%, between the ages of 65 and 79, and 1,506, or 17%, of persons who are over the age of 80. Of the vaccination sites, and based on the EPI week ending the 6th of February, the vaccination center at the police, or 57% of vaccinations, 552, or 6%, were administered at rest homes and long-term care, and 3,291, or 36%, were administered by the Bermuda Hospitals Board, and 58, or less than 1%, were administered. Assessed against our vaccination targets, the ministry can report the following: 1,309 persons 80 years or older have been vaccinated. 197 are fully immunized, meaning that they have had 2 doses, and 1,112 have had 1 vaccination. 370 persons, or 50 care facilities, have been vaccinated. 182 are fully immunized, and 188 have had 1 vaccination. 1,166 healthcare workers or 43% have been vaccinated, 339 are fully immunized, and 677 have had 1 vaccination. I would like to strongly encourage more men to be vaccinated and to register to be vaccinated. As you can see from the charts, only 44% of those persons that have been vaccinated thus far are male. And according to a recent paper published by researchers at Yale University, men are around 1.7 times more likely than women to die from COVID-19. And additionally, men older than 30 have a significantly greater mortality risk. As I reported last week, we are now moving towards phase 2 of the National Allocation Strategy. And while we continue to ask those in priority groups 1A and 1B who have not yet registered to please register and be vaccinated, and remember, some essential workers may be younger than our seniors, but they are Group 1 priorities. We are also now asking those residents in Phase 2 to register their interest online at forms.gov.bm/COVID vaccine. Phase 2 is people 50 years and older, as well as vulnerable people, those with heart disease, chronic kidney or liver disease, and diabetes, for example, essential travelers, and residents with disabilities. Some residents may be aware that we have had to take down the online registration form over the past weekend so that our team could continue to undertake necessary upgrades as we move to Phase 2 registration, and this form was back live yesterday morning. The upgrades were necessary in part because we are aware of some individuals in the community receiving their vaccinations seemingly not in the order of the ministry's vaccine allocation strategy. Now, while out of the thousands of vaccines that have been administered to date, this is a very small number of people, but though it is unfortunate. The vaccine team has worked very hard to prioritize and make appointments for persons in Phase 1A and Phase 1B. Doing this manually provided extremely time-consuming, particularly in face of the overwhelming responses received when we asked residents to register their interest in being vaccinated. Over time, the team developed a more automated process for ensuring persons in the target groups were scheduled for a vaccination based on keywords as self-reported in the registration process. It became clear, however, that while the scheduling was quicker, some people got vaccination appointments who would not ordinarily have been in the target group, while others who we wanted to capture missed out. One of the refinements of the new registration form, which, as I stated, went live yesterday, includes an improved ability to prioritize members of essential service, for example, and other key groups. We cannot guarantee that persons outside a particular target group will not receive a vaccination appointment, but the change reduction in these already low, and I say low, numbers. That said, the ministry will be issuing an RFP later this week, which seeks to engage a vendor for a new pandemic response administration system to cover all aspects of the pandemic, from testing through vaccinations. Please remember that registering your interest does not guarantee you an appointment at this time. When you submit your registration form, you will receive a receipt. Your submission will be filed. Remember that, to the best of our ability, appointments are based on a medical risk assessment that, in turn, is based on age and clinical vulnerability. And with the new enhancements and eventually a new system, we hope that this will be quicker. Every submission will be replied to, and there is no need for you to resubmit. With regard to the number of persons who have registered interest, to the week ending the 6th of February, 15,133 persons have registered their interest in getting vaccinated, and the breakdown is as follows. 2,866 are black, 7,549 are white, 1,410 are mixed or other, and 3,308 prefer not to say or did not supply that information. And for those of you who have registered already, thank you. It is critical that we do everything that we can to reduce the spread of this deadly virus, especially now as we witness the effects of the apparently more dangerous mutated viruses that are closer to our shores. As I reported previously, the Ministry of Health has been working diligently to identify COVID vaccine centers in order to reach our goal of having 1/3 of our residents vaccinated by the 31st of March. And I'm pleased to announce that Bermuda's new COVID vaccination center at the Bermuda College campus on the South Shore in Paget will open next week, Monday. The target for the initial vaccination center at the Prospect Police Club was to administer 200 doses per day, and I am happy to report that we have continually met and exceeded that target, frequently administering more than 400 doses a day. Similarly, the target for the second vaccination center at King Edward Memorial Hospital was 200 a day, and again, I am pleased to report that we are exceeding that target by close to 250 a day. With additional doses received from the UK, new targets are in the process of being set, and I am sure with the continued efforts of the hardworking team at the Ministry of Health, we will meet those targets as well. Targets are set based mainly on the quantity of doses that we have to administer. A number of criteria feed into the decision matrix, including the physical number of nursing stations, the length of time it takes to complete the necessary paperwork, the actual administering of the vaccine, and the required waiting time and observation time after the jab, and other logistical factors such as the safe handling and delivery of the vaccine, and the number of medical personnel that are trained that are also available. The Bermuda College campus site will allow us to open up to 10 vaccination stations versus 6 that we currently have at the Police Recreational Club, and it will allow us to run the site for longer hours, namely from if we must, with the necessary observation space. Included in the 9,095 total number of vaccinations administered so far, there are 1,591 persons who are now fully immunized against COVID-19. By this I mean these are residents that have received both doses of the vaccine as recommended, and it is extremely important to receive both doses as the 2-dose regime is proven to be dramatically more effective. While you can get some immunity, approximately 52%, from the first injection, the second dose boosts the immunity to 95% effectiveness. I would ask all residents who are scheduled to receive their second dose, please do not miss this appointment. And please attend the second dose at the Bermuda College again starting on the 15th of February. We will also send notifications to those who are already booked for their second appointment. If you do have to change your appointment, we ask that you call the vaccination hotline at 444-2498, selecting option 2, or email vaccine@gov.bm as soon as you can so that we can reschedule your appointment. Wearing masks, physically distancing, good hand hygiene, and downloading the WeHealth Bermuda app will help reduce your chance of being exposed to the virus or spreading it to others, but these measures are not enough. The vaccine will help with your immune system, so it will be ready to fight the virus if you are ever exposed. If you do get COVID-19, you are likely to experience milder symptoms and become less ill as your body is better able to fight off the virus. Those who are not vaccinated are at a higher risk of becoming infected if they are exposed to the virus, and if they become infected, they are more likely to develop serious illness compared with those who have been vaccinated. They also risk further passing the infection on to others. This includes people in our population who are unable to develop an immune response to fight infectious diseases and are at a high risk of serious complications and death. Remember that not everyone can be vaccinated. There are people with underlying health conditions, such as a severe allergy to a vaccine component, who may not be able to get vaccinated. These people can still be protected if they live among others who have been vaccinated. When a lot of people in a community are vaccinated, the virus has a hard time circulating because most of the people it encounters are immune. In other words, the virus comes up against a dead end. The more others are immunized, the less likely it is that people who are unable to be vaccinated are put at risk or even of being exposed to the virus. This is herd immunity, and this is our goal. We have been getting questions about the side effects of the vaccine. While no major safety concerns have been reported, you may experience some side effects for a few days after you get the shot. In addition to a sore arm and swelling at the injection site, side effects reported by some trial participants include tiredness, headache, muscle pain, joint pain, chills, and fever. This is normal, and it is not an indication of COVID-19, as there is no COVID-19 in the vaccine. These minor side effects, which are not experienced by everyone, is your body's immune system responding. If, however, the side effects are more than mild reaction, you should Side effects are less common in patients 55 years and older, and they occur more frequently after the second dose. If you have a history of severe allergic reactions known as anaphylaxis, talk to your doctor before you get the vaccine. Please remember, vaccinating not only protects yourself, but also it protects your loved ones and those in the community who may not be able to get vaccinated. If you can, please get vaccinated. Before I close, I want to remind residents needing outbound tests that you must book yourself in for outbound traveling tests via the community sites, which are at Pennell's Wharf, Bull's Head, or Star of India. Do not go to Pirot Post Office for this. You can book through gov.bm/coronavirus, get tested. There will be no walk-ins. Book 2 days before the date you plan to leave Bermuda. This meets the 72-hour rule imposed by the United States, the United Kingdom, and Canada, and gives the MDL lab more leeway to process results in time for your departure. You should not get the test the day before your day of travel, as this leaves no room for unexpected. And as always, stay safe, Bermuda. And remember, I wear a mask to protect you, and you wear a mask to protect me. Thank you.
Thank you, Minister of Health. And I certainly would like to commend you and your team for the excellent work to date in scaling up the vaccination program. Over 4,000 doses administered last week is excellent progress, And you and all those who have worked so hard to accelerate our pace of vaccinations are certainly to be commended. At the close of today, almost 10,000 doses of the vaccine would have been administered, including over eyes. I know, without question, that there have been some logistical and technical challenges. This is to be expected with an initiative as large and significant as our vaccination program. However, Bermuda, the teams involved are working extremely hard, as all of our teams on the front line have done throughout the pandemic, and I would certainly like to relay our immense appreciation towards them for the tremendous job of which they're doing. Thank you, Minister, for leading this team. If you can register online, I encourage you to do so. Go to coronavirus.gov.pm and click on COVID-19 vaccine registration. If you do not have access to the internet, you can certainly use the hotline at 444-2498. And as mentioned, the government is working to increase its technical capacity to ensure that we can meet rising demand. The government is also who are eligible but may not have access to ensure lack of access to technology should not prevent you. As the Minister of Health said, we are aware that some people have experienced adverse effects after receiving the Pfizer-BioNTech vaccine. These side effects are normal, in most cases being mild. If you have concerns, speak to your doctor to get credible medical advice on how to deal with these side effects. But please do not be deterred from getting your second dose unless you have spoken to your doctor. When you take the recommended 2 doses, this vaccine is 95% effective in preventing serious disease from a coronavirus infection. I must emphasize how important it is, as the Minister of Health has said, to get the recommended 2 doses. The first dose gets your body ready and acts as a primer, and as stated, is only 52% effective in preventing serious disease. The second dose is given 3 weeks later and gives your body the full immunity it needs. And certainly, we are aware that there are more severe reactions to the second dose, but that is according exactly why that is the case. Persons should speak to their medical doctor for advice, and as I said last week, that it is unfortunate that there are some in the community who wish to discourage persons from making a decision that should be between an individual and their doctor. I am grateful that the vast majority of local doctors have taken the vaccine and have also encouraged their patients to do so, as they trust the science. If you have received the vaccine, share your experience with others. Let your family and friends know why you made the decision and what it means to have received the vaccine. Without question, the government is certainly working on the announcement today of the confirmed 3rd vaccination site and the significant progress that has been made. Earlier today, Government House confirmed that the next tranche of vaccines from the United Kingdom are scheduled to arrive on island on February 25th, and further details, including the exact numbers of doses, will be provided in the coming days. As a country, we have all lived through the difficult reality of stricter regulations, unable at times to see our families and socialize as we'd like with our friends. None of us, including me, wish to experience that again. This is the reason why we are being so deliberate in the relaxation of the measures that have been put in place. The measures are in place so that we can safely advance towards a time of little impact from COVID-19. We can only do this by working together and remembering that we all share a common goal: to protect ourselves and our loved ones from this virus and get back to life as we would like to live it. To achieve our goal, we must use the tools that we have at our disposal. If you are eligible, please make sure that you register for the vaccine today. Attend your appointments when given and receive both shots of the vaccine to ensure that it's fully effective. And also make sure that you avail yourself of free testing for residents. Adhere to the regulations that are in place to keep us safe, and download the WeHealth app. And I cannot express again how important it is that we have not reduced the testing capacity. We do have testing capacity in Bermuda. If you are experiencing symptoms and others, you shouldn't go to a testing center. You should certainly call the hotline so something can be done, so an appointment can be made. But if you have attended, maybe you slipped your mind and attended a party with a whole bunch of people on Sunday, and you might feel that, it probably wasn't the best idea, avail yourself of the free testing of which we offer by the government of Bermuda. We have testing capacity. The testing capacity is available. The island and the center of the island, please make sure you take advantage of the testing capacity that we have. It is vital that we do that. Next week, the government will be announcing changes to the current measures in place for all residents and visitors. Also, the government certainly and will act under the guidance and recommendation of the Ministry of Health and Chief Medical Officer. However, it is important for the public to know, especially those persons that work in and depend on our tourism and hospitality industries for a living, that we are examining the options and learning from our experiences that were gained last year, while also keeping in mind the changing global circumstances as they exist. The government is also working to get Bermudians safely back to sport and to sporting events. Last month, the Minister of Youth, Culture, and Sport, Dr. Ernest Peets, announced a 4-stage program to help being able to enjoy playing and watching competitive local sports again. The government has rolled out a testing that may be in the community that could easily turn into an outbreak as we move back to competitive sports. You can imagine a locker room full of individuals who have just finished playing, one person being positive, and then that can lead ourselves to another outbreak situation, which is what we want to avoid. So I'd like to thank the national sports governing bodies and the Department of Youth Sports and the Department of Youth and Sport in conjunction with the Ministry of Health for working to ensure that sport can resume safely. And that testing program will be a surveillance program which will be administered via saliva tests. And that is certainly good news for the persons who want to play sport. Also in making sure that we minimize our risk and take advantage of our excellent testing capacity in Bermuda. In closing, I ask for all of us to take stock of how far we have come. Our active and confirmed cases are low, and now, as the minister has said, in single digits. Growing numbers of residents are receiving the vaccine, with some already fully vaccinated, and more persons registering by the day. We have successfully managed a second wave or a recent outbreak where many other countries have not been able to do so successfully. However, I would like to remind everyone that what we do today plays a significant role in our lives tomorrow. We certainly have a lot to be proud of, but still a long road ahead. We must continue to make the responsible decisions that protect us, protect our loved ones, and protect our country. And I'm grateful for the support of the people of the country as we continue to move through this pandemic. I know the decisions are not easy, and it is easy to recognize the criticism which may come. But the decisions that are being made are based on the best interests of the country, balancing all of the available evidence, all of the available consider the best outcome when we balance all things. As I close, I will remind that we know that many in our community may need extra emotional support. If you need someone to talk with, please take advantage of the Emotional Wellbeing Hotline. That phone number is 543-1111 and is open every Monday through Saturday from 5 p.m. to 9 p.m. Again, that phone number is 543-1111. To ensure that you get accurate, reliable, and timely information, make sure that you subscribe to the government's WhatsApp service. Add the phone number 504-6045 to your contacts and send us a simple message saying hi, and you will. Alternatively, if you want to get updates from the Tree Frog app, download it on the Apple Store or Google Play. And if you do not have the WeHealth app installed on your phone, make sure you get it today. And I'm pleased to see that the registrations and downloads for WeHealth app after recent marketing campaign have picked back up again. It is important and essential that we make sure that we take advantage of the technology that we have in Bermuda, which is far and above what they have in most countries around the world. With that, members of the media this evening.
Good evening, Premier. We'll start with TNN.
Good evening, Trevor Lindsay from TNN. Minister of Health, I'll start with you, possibly getting an answer from the Chief Medical Officer.
If it's technical, please.
Yeah. I've been called by many family members from, and I'm not sure if you're aware that the number of persons that have experienced side effects after taking the second dose of the vaccine, i.e., seizures, one individual, a few individuals are possibly seizures and experiencing severe headaches. Why might this be the situation? And I know for a fact someone very close to me having issues of severe headaches, long spells of headaches.
Okay. So I'm slightly surprised about seizures because we have a system in place to record adverse incidents to the vaccines, and that has not come up yet to us.
Okay.
So if you're telling me that, I'll possibly like to meet with you later on to get the details of that.
Sure.
and investigate that. But headaches, yes, they are a recognized side effect of this. Usually it goes within 24 to 48 hours, and most people are clear, are relieved after that. Simple Tylenol, some water, some rest will get you a long way.
Okay, thank you. Another question for Minister. We hear daily that in spite of the best efforts of government and the best efforts of the seniors, that there are many who say that they they've tried the hotline, but since registering for the vaccine, they have still not received a call. Would government consider a special vaccination session for only seniors who have somehow fallen through the cracks?
Thank you, Trevor. Admittingly, we have had some challenges with respect to the hotline. In fact, as you would note, we indicated, I think there was a press release yesterday and Friday, that we have a challenge with respect to the queue system. So when persons call, they go in the queue, and then unfortunately the persons that are actually answering the phone don't actually hear a call, which is why we've been inviting people to continue to call. We have contacted technical support. We are anticipating that will be resolved tomorrow. We have sufficient lines as well as sufficient human resources to be able to answer the calls. We did indicate previously, and if it's a senior in particular that you're aware of, then perhaps we can share that information afterwards, because there were a number of seniors that unfortunately did not provide the correct contact details. They may have put a hashtag as opposed to a 3, and mistakes like that do happen, which would make it very difficult for persons to be able to contact them. So if you want to chat with me afterwards about that, because I know that there have been persons that, in fact, that I've looked into myself, and then when we look at the phone number or the date of birth, the information's inaccurate, and it's just perhaps a typographical error. But if the information's inaccurate, then we're unable to contact them. And we know that there's about 60 people that may have fit into that category.
Okay. Another question from a member of the public that have received the second jab. What are the quarantine and COVID testing requirements now that these persons have had the second jab, if they were to get the coronavirus again?
Well,
would it be the same?
Yeah, it would be absolutely the same. If they were to contract COVID again, which is unlikely, but if they did, then the same continuum that we have online with respect to the quarantine provisions would be equally applicable.
Yes.
So you said
And
unlikely.
just, hold a second. And just to clarify, as I said in my statement, As we said in last week's press conference, the press conference the week before, at next week's press conference, we'll be announcing changes to any quarantine or travel requirements for persons who have been fully vaccinated. And that timeline was 2 weeks from the time that second doses were available in Bermuda. So if you're asking about what the difference may be, and as I've indicated in my statement and in the last two press conferences, that those announcements will be made at next week's press conference, when we have the first persons who will be residents of the country who would have been 2 weeks from their second dose of the vaccine, which is, as I understand it, and the CMO can confirm, is when the time that they say you're fully immune.
I just want to challenge the minister just now because you said very unlikely that after having your second jab that you will not get coronavirus.
No, we've got Dr. Io is here and he can explain that, but we know the jabs. The vaccination is 95% effective, and that if a person does contract COVID, then the symptoms are very, very mild, if at all. But I'll leave it to CMO.
But you did say very unlikely.
If I can just comment on that. So it's what the trial data tells us is that 19 out of every 20 people who've had this vaccine are protected from coronavirus disease. What that means is they don't get ill from this. And even those who actually got ill in the trial studies, none of them were seriously ill. And none of them had to be hospitalized. Tells us. And that's why we have from the coronavirus disease. That's a slightly different thing from whether they're able to still carry the virus in their airway and transmit it to others. That's a slightly different thing.
Thank you. Another question on this topic. Minister, when will doctors be able to give their patients the vaccine jab shot?
As we've said previously, requirements for the. In fact, the Ministry of Health, we purchased sub-zero freezers for storage. The majority of, I don't think any of the doctors have that type of facility within their actual surgeries, which is why we have solicited the physician's assistants assist with providing on weekends, but none of them have the requisite cold chain requirements that would be able to house the Pfizer. And again, we don't want to have any wastage.
I know I'm limited questions. I have a supplementary, so that's okay. I've got two questions. I have a supplementary to the side effects. Are we going to see another brand of the vaccine, Johnson & Johnson, or the other AstraZeneca, is it?
Yeah.
Brought to Bermuda that might have different, might even minimize side effects to the one that we currently have on?
Different manufacturers and different, we're part of different initiatives to get vaccines on the island. I believe the ministers announced that we're part of the COVAX facility and certainly the AstraZeneca and to a smaller extent the Johnson & Johnson vaccine is part of that mix. So that's part of the mix of what we're bringing to the island. In terms of side effect profiles, what's been published in the trial data, there's not a lot of difference in side effect profiles to all of this. I must emphasize again, mild and transient, and certainly in no way compares to having the COVID-19 disease.
Thank you. My last question. Premier, forward with a comment in the wake of the $11 million payment to GenCom, to the government. First of all, thank you for giving me the opportunity, as I was not in the media room. Premier, you neglected to say that GenCom only paid the $11 million after the threat of a class action suit by the workers, a suit that had to be funded by the government. And I quote a Glencom representative. It is due to relentless efforts made by our parties that the funds have been secure and reimbursed during this difficult time. The alternative to repayment, a condition of the Ministry of Finance dealt with the ex-staff, not Glencom, would have been a class action lawsuit by the records against Glencom. The government would have to have paid the legal costs in the action if the action had gone forward. Sir, this is called the carrot and stick approach. So thank you for allowing me to make a point that I brought forth several weeks ago.
Okay. Company is Gencom. I appreciate what it
Gencom,
is you're
yes, sir.
saying. What I can say, Trevor, is I stand by my comments, and I was shocked that after asking me the question every week, you didn't ask it last week.
I was cut off. I was cut off. I don't know if you was on my end. I was cut
it's-
off. So
it's okay. Not a problem, Trevor. Not a problem.
made
But it's
myself
not
present
just you.
today
It's
to-
silence from the opposition, silence from everyone. No one even, the lack of comment. The fact is, the country is fortunate to have a man of the caliber of Curtis Dickinson as the Minister of Finance. He did an excellent job under incredibly difficult circumstances. There are some people who believe that the government should have let persons starve or go on financial assistance and all the rest. That's not what we're about. And so we will take the lumps when people say, oh, look what you've done, look at what you've done. That's fine. But I know there are 500 and 600 people and families who are grateful that this government acted. I know that there are the members of the Bermuda Industrial Union that are grateful that this government acted. And this government not only acted, it protected itself when people said, oh, there's no protection. That is not the case. The Minister of Finance did a great job. I'm happy that we're at this point, and now it is a responsibility of me as the Minister responsible for tourism to go ahead and make sure we advance this project with the parties involved and move forward. And that is what I intend to do. So I appreciate you bringing it up. It's important to advocate for this particular issue. But the fact is, what you should do, Mr. Lindsay, is ask those persons who certainly went on your website to say, how can the government go ahead and do this now without protection? Ask them, what's your comment now? That's it. We're all exactly the same thing. What's your comment now?
end result of win-win.
Premier, World Gazette.
Good evening, all. Thanks for having us. Yeah, Jonathan Bell from the Gazette. And yeah, we all get the comments about it. You know, it's all of us in the media with the GenCom payment. Doctor, I think I'm going to start with yourself. It's a bit of a technical question. So we believe that a batch of vaccines came to the country on the 18th of January. Would you be able to say if that's correct, how many doses came in, and if they were from Public Health England?
Dr. Io, can I just deal with this for a second? For
Okay.
some reason, I have no reason why Sam Strangely keeps asking the same question to the Ministry of Health. We have said when the vaccines landed, we can't
And we
make
said-
up and invent
and
a
we've
secret
said the
shipment of
number.
vaccines. I
Definitely
don't know
not.
how
Okay.
many 18th is going to be asked. We've had the first time the vaccines arrived and the second time the vaccines arrived, and those are the only vaccines that have arrived in the country. I have no idea why this question keeps coming up. We respond and say, these are dates that are coming, and it's as though if there is some secret shipment. There is none.
I don't know, sir. I will strike that one from my list.
Thank you.
Absolutely.
Moving on. So we've heard of a couple of examples of non-residents who got the first jab of the vaccine. Presumably, can we clear it up? If you got the first jab and you're here, will you then be getting the second vaccination dose if you're a non-resident?
I know that was reported by the Royal Gazette, so I guess that means it's true, that there were persons that, pardon?
Sorry.
Go that far.
I was being very sarcastic. I'm sorry, Jonathan. That wasn't meant to be a dig at you. We've vaccinated over 10,000, administered over 10,000 doses. If a few persons actually slipped through and got their vaccination, we're now, like I said, requesting ID confirmation of residency. So if that's the case, they won't be, unless they can prove that they're residents, and you're claiming that they weren't, they won't be able to get their second dose.
Clears that one up. Cool. I think there's a bit of there's we could use some clarity around phase two. Are we in that, or do we know when we're getting to it? Are there some people from phase two that are being vaccinated? Just do we know when that happens?
Phase two, we are inviting people to register for phase two now, but you'll recall, as I've indicated, and it's on the website, phase two does include persons that are vulnerable. And so those persons could very well be getting the vaccination because of their medical vulnerabilities. When people register for the vaccination, we have a medical team that are actually looking at the applications to assess areas of vulnerability. And oftentimes people say, well, they're younger than me, why are they getting a vaccination?
We
If
hear
you're a
a lot of that, yeah.
69-year-old individual that's in the fit of health and wellness, and then unfortunately there's a 30-year-old that may have a number of medically vulnerable issues, and that person will be prioritized because of their medical vulnerability and their frailties.
Thank you. Oh yeah, trying to read my handwriting. We had, I believe it was 250 test results that are in the latest number. Are we maybe needing to up our game in terms of us in the public getting tested? Have we slacked off on testing? Should we be, getting tested more if we have the opportunity to do so?
We have a great supply of the availability of resources for testing, and perhaps the Royal Gazette could assist us in facilitating getting that message out to people.
Yeah,
that
I mean,
we have.
us the public in terms of going and doing it.
Absolutely,
Should we
and the Royal Gazette could assist us in that regard. We need the public to take advantage of the fact that we have free testing on island. You can get tested at on the east as well as on the west. You just make an appointment online and you book it and you can get a test. We have sufficient supplies. We have operated a very aggressive testing regime for quite some time now, and we encourage anybody and everyone, if you want to get a test, if you want to know your status, make your appointment and you can get a test.
Jonathan, if I may just add to that, I misspoke earlier, so I just want to be corrected. As the minister has no doubt, testing is available 7 days a week, not 6 days a week, as I had said previously.
Okay.
Certainly, some of the volumes that are falling are due to the fact that there are some days where there are no flights coming in. So you're not having the arrival tests that you had the day 4 and the day 8 and the day 14 follow-ups. But the minister is perfectly correct, and we would welcome the support of all media houses in reminding persons the importance of getting tested.
Thanks. I was curious, we hear about this South African variant on the virus. Where is it in our radar? Are there discussions being had of when this other variant could potentially arrive here and how we may have to react to that? That could be one for yourself, Doctor.
Okay. So, first thing to say is that viruses mutate. That's what they do. And the way in Bermuda, where there are several options open to us to be able to check what sort of variants that we're dealing with. So we have an option to go through CARFA, we have an option to go through Public Health England, and the MDL lab is presently scaling up its capacity to do that in-house. So we're monitoring that and monitoring how that relates to the epidemiology of the virus on island. So, but the most important thing to say is that regardless of what variant you're dealing with, the control measures are basically the same. Keep your distance, wear your mask, wash your face, sanitize your hands, avoid large crowds, and get vaccinated. And also use the WeHealth app, because that then tells you if you've been in contact with somebody who is positive and allows you to put those measures in early.
Gotcha. Thanks. Last one, I was just curious, really. We've seen some good numbers with people registering for the vaccine. Are those numbers, do they have any bearing on when and how many numbers of doses we might next receive of the vaccine from England? As in, is that a further prod for those of us who are eligible right now to sign up? Are they watching our numbers?
The short answer to your question is yes.
Okay.
And the fact is that you are certainly not going to get more vaccine if you are not able to use the vaccine of which you have. And so the short answer to your question is yes. And whether that would be from the COVAX facility in the future or future supplies which may be provided by the United Kingdom, the answer to the question is yes. And so, we are fortunate that we are well on our way to making sure that we vaccinate our population. I would say that it is probably accurate figures to say that in excess of 10%, maybe like 12 or 13% of the population, a higher number of the eligible population have at least received one dose. And so we're certainly pressing ahead in that regard. But there are some countries that don't have any. And so we'll have to see where we get down the road. But absolutely, it's essential in order for us to make sure that we want to get more or to receive more, that we are able to distribute what we have and effectively scale up our operations. And I think that's why it's such an excellent job. I had a call with the Ministry of Health last week, Thursday, and the minister, the CMO, reported that we were up to 700 doses administered a day, and that is absolutely incredible work. And I remember reminding persons who were trying to compare us to other places, I said, we've been there before. Our job is not a race. It is to make sure we do it well, and continue the pace. And I think that we've done an excellent job of certainly continuing this pace. So kudos certainly to the health team led by the minister and supported by her technical officers and the chief medical officer.
Thank you very much.
Thank you, Jonathan.
Premier, Bermuda Broadcasting.
Good evening, Don Burgess, Bermuda Broadcasting. Approximately how many people in Bermuda will need to be vaccinated in order to reach herd immunity of 70% of the total population?
Right. So the total, I don't have the number right on top of my head, but we're working on approximately 36,000 people needs to be fully. No, that's not correct. Let me get back to you on that because I don't have the exact number on my head. But we need to get approximately 70% of, give or take, of our population vaccinated.
Yeah, but approximately, that's what I said, 70%, but 70% of what number?
Of the total population.
Adults and children?
Yes.
Okay. All right. With the sequencing, have we seen the South African or UK variants here?
Okay. I don't particularly like those terms, but yeah, the sequencing that we've done so far has not identified any of those new variants or novel variants that are causing that are of public health significance so far. So, but we've only sequenced a small proportion of our positive cases, and we're working to sequence the rest to tell us if we've been fortunate to deal with it effectively or we've been fortunate not to have them at all.
Okay, thank you. And this may be an off case, but two married people, one went to the hospital this week for their vaccination, and one went, or last week, and one went to the Prospect Center. And it appears that the vaccinations at the hospital center went running smoothly. There was no problems. But the person who went to Prospect had to wait 2 hours to get their
It's a combination of staffing and scheduling. You would have heard me previously speak about getting assistance from physicians, persons in the medical community, to assist us with respect to administering the shot. You can appreciate that the majority of persons that are actually administering the shot at the Prospect are also community nurses, so they also have a full-time job, and they've been doing COVID full-time. So they're shifting between the one function that they have within the ministry, as well as providing the necessary support and assistance concerning the administration of this vaccine. So again, we're working on the scheduling aspect, as well as getting more persons to assist from the medical fraternity, which we are working on now. So we will be able to see some improvements as well as we move forward.
Okay, thank you. The number of vaccines currently on the island are only enough for around 33% of the eligible population. Does the government have a timeline for reaching the next 70%?
Well, as the Premier indicated, we are anticipating the next volume of doses from Public Health England on the 25th of February, and you would have also heard me speak about the COVAX facility, which should be sufficient for 25,000 doses that we are anticipating in March, correct?
From March.
Pardon me?
From March.
From March.
From March. Okay, thank you. Premier, you mentioned the coming resumption of sports. It's good for their physical and mental health and for socialization. Will children under 10 years who want to play sports be required to take a monthly COVID test? And for those adults playing sports, how will clubs know if everyone takes the test and is eligible to play if the test and test results are confidential?
I don't know the specific details which have been worked out between the Ministry of Youth, Culture, and Sports and the national sports governing bodies. That's a good question. I'd ask you to pose that. I would like to answer your question, but I don't actually have the answer at my fingertips. On the issue of those under the age of 10, I don't actually believe so because we don't test persons under the age of 10 aboard. The CMO is shaking his head. Yes, but that is a process which we're working through. I think the most important thing to recognize when it comes to the safe return to sport is just because we are reporting 9 active cases, there could very possibly be more cases that are in the community. And when sports that are played around this, talking about physical exertion, talking about leaving the pitch is a little bit cold, possibly going into a locker room, persons there, enclosed space by chance, and if there's one person that's positive, they could easily turn into an outbreak situation. And so what we're trying to do is to make sure that we prevent that by having a simple saliva test screening before a person return back to sport. It'll be a very simple way that persons can assist, and it will help to make sure that we can return to sport safely. That we're trying to make sure to do is that we don't, and it only takes one outbreak for us to get back to that place, and that is what we are trying to avoid. So recognize the criticism saying, oh, this is singling out all the rest. That's not what this is about. This is about trying to make sure that we use all of the tools at our disposal, which we are very fortunate to have, where we can implement test regimes that are used in professional sports and other types of places here in Bermuda, and that's what we intend to do.
Okay, thank you. And the last one's a bit more personal. Premier and Health Minister, you received your second vaccine doses last week, Monday. Did you develop any symptoms that were stronger than your first dose? And do you feel a sense of personal relief at being protected by up to 95%?
Question first. Absolutely. I feel an enormous sense of relief having had the second dose of the vaccination, being fully immunized now, 95% effectiveness. In fact, I had lunch with a girlfriend of mine, and she teased me saying, oh, now you're having lunch in public because you feel like you're immunized. Admittingly, I had the second dose last week, Monday. Admittingly, on Tuesday, I was a little bit worse for wear, but I knew it was a temporary reaction and that it was my body's way of saying you are becoming immunized to a very deadly disease. So I just suffered it and took some time.
Mr. Premier?
My answers are very similar. The answer to the second question is yes, certainly. It feels good, but we won't rest and feel good until we are able to make sure that we get everyone in the country who wants access to the vaccine to have access to the vaccine. And we're very pleased that people are following the example. The story and controversy that's being stirred up and everything around this, I just want people to speak to their doctor and make the decision for themselves, as I think that's important to do. We're not forcing vaccine. Their family. Regarding the first, I left because it was very funny. I was here, I was fine. We were kind of teasing the Minister of Health in cabinet earlier in the day because in the morning she was like, "Oh no, I'm not feeling very good." We almost asked her to go home, but she was fine by lunchtime. And you saw her; she was here last week and did the press conference. After the press conference, actually, I was feeling perfectly fine. It was about 24 hours. It all was kind of cold, and I had chills, so I kind of just had chills for the evening. I took 2 Advil when I went to bed. The next day I was fine. So I mean that's the extent. People do report more adverse reactions. The CMO could explain why that's the case. I'm sure there is a medical reason why that's the case, but no, feeling fine. and there are other persons who have had more serious adverse reactions after the second dose, but that was all that has been recorded inside, and it's all fully expected, and there is a medical reason for it. Apparently, it happens more in younger persons than in older persons because younger persons' immune systems are stronger. So, yeah, I think we're good.
Thank you for sharing your stories, and thank you to CMO for being here to take questions tonight as well.
That's it.
Thank you, Premier. There are no more questions.
All right. Well, thank you very much. I want to thank the members of the country, people of the country for their attention. Thank the members of the media for their questions. Certainly thank the CMO for his attendance today. Please come back next week so the Minister of Health and I are stuck answering medical questions. Certainly thank, of course, our wonderful sign language interpreters, making sure they provide the news, and our team here at DCI who work to make sure that we can relay these messages to you. We'll be here next week, same time, probably 5:45, hopefully, where we will certainly be announcing the next stages when it comes to restrictions and changes to restrictions, which will be decided by the Cabinet next week, Tuesday, in addition to revealing the changes to rules that will be in place for those persons who have been fully immunized. So I want to say thank you, Bermuda, and good